You're 48 years old, struck by suffocating lung disease that has a nearly 1 in 3 chance taking your life away, leaving your family behind. This is such a patient who presented to us at Montgomery Heart and Wellness, and this is what we did next. So we are here discussing this 48-year-old lady who had this sudden onset of this what appeared to be a suffocating lung disease. Can you tell our audience about that?
She came to us and she'd been having these progressively worsening symptoms for about a year. And initially it started where all of a sudden she'd get mucus buildup in the throat, runny nose, and coughing like she couldn't breathe. But it started to become more and more frequent and more intense to where she felt like she was going to die. And it's got to the point where she couldn't work out. She wouldn't make plans with her family or friends because she never knew when these attacks would come on.
Oh, wow. So it literally took her life away even though she was still living. Now, she saw multiple doctors. What did they do?
They tried a lot of inhalers, steroids, antibiotics, but she was still getting worse. So at this point, she was feeling really helpless and she was losing hope. So she came to us kind of like a last-ditch effort to try to do something before giving up.
We see patients like this frequently who have these conditions. They don't have a clear diagnosis. It's an overall syndrome. And this syndrome with this swelling of the lungs was a type of condition that had nearly 1 in 3 chance of taking her life away. And so this was pretty serious because even though she felt helpless, in a way, she literally was helpless. Everything she had tried, did not work, and so she was miserable. So our approach was to approach and attack the underlying cause, as we do. And in this case, there's a condition known as inflammation. We talk about that a lot. And inflammation is something where you swell. If you've ever fallen off a bicycle and scraped your arm, it gets red or swollen. That's inflammation. Congestion, sinus congestion, pus running out, that's inflammation. So this is a condition that built up in her lungs and her airways, and it started attacking her on a frequent basis. So our approach was to hit at the nutrition, which affects it at the level of the cells. And we did several important things. So in addition to the nutritional detox, there were 2 other things that we applied to her.
And put her on the seropeptase, which is enzyme or molecule that helps to break down buildup of mucus and scarring and inflammatory cells. And we put her on curcumin. It's like the main component of turmeric. A lot of people have heard of that spice. And that also helps to make the body heal and quench that inflammation.
I want you to understand that this approach with the nutrition cuts off the source, because probably the trigger to this process of her suffocation and the inflammation and the swelling of the lungs was something that she was ingesting. So we cut that off. And by cutting that off, we put the fire out.
Right.
And then we add more things to help the lungs heal, help her airways heal, and she got better. So what was her response after we treated her? We saw her back within 4 weeks.
Right, so she told us that actually in the first week she got off her inhaler, which is amazing. And she started exercising again and started socializing again, which really made her feel more optimistic and happy. She was getting her life back, her physical, but also her mental health, because she had pretty much isolated herself due to her illness. Some
of the lab findings at the very beginning were not severely abnormal, which was a peculiar thing with someone with such a bad condition. However, I will point out that from the beginning, her white blood count, which is a measure of your inflammation, was 6.0, and that decreased to about 4.7. So that was almost a 30%, maybe a 29-30% reduction in white blood count. Why do I point that out? I point that out because that represents a reduction in the amount of inflammation in the system. So when the body is fighting some kind of a foreign agent or think it's fighting something foreign, it increases the white blood cells that it makes. When that threat goes away, the white blood cells that it makes go down. So we saw that her body was making about nearly 30% fewer white blood cells, which told us that the body felt less threatened, and therefore she was doing better. So even though there were labs, her blood tests were not overtly abnormal, lots of doctors try to look for abnormal blood tests, but we look for fine details in the changes, and that told us a lot. Anyway, she got better. We saw her 3 months later, and she was still doing better, except something happened.
Yeah, there was a period of time when she veered off the healthy, plant-based foods, and so she had an exacerbation and flare. So all the same symptoms just hit her really hard, and so she had to take steroids. And so then in that blood work, we saw one blood test that does indicate inflammation spiked up.
Yeah, so she relapsed in her diet, and her condition relapsed, and she immediately turned it back around and got better again. And so clearly a situation where we have a cause and effect from a nutritional standpoint. Her disease was primarily in the food she ate, and we target that first and foremost with some additional important supplements that help heal the lung. So, great case and interesting story, and she has her life back.
Yes, she does.
Hope you got a lot out of that. And as usual, if you have any questions or comments, leave them in the comment section. Until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification